Also tonight, Governor Gina Raimondo says she's still hopeful Rhode Island can move to phase 2 of reopening next week. I'm Shannon Heggie.
And I'm Mike Montecalvo. However, she says even though more places will reopen, it's not a time to relax the rules. And today, the Rhode Island Department of Health reports another 21 people with COVID-19 have died, bringing the state's death toll now to more than 650.
However, the number of people in the hospital has decreased to 218. The governor says hospitalizations have dropped 40% in the last month. This afternoon, the governor talked about the new regulations people going to the gym will have to follow.
Eyewitness News reporter Kim Kalunian joins us now live from the State House with more. Hi, Kim.
Hi, Mike. Hi, Shannon. With gyms scheduled to reopen next week, you might be wondering, do I have to wear my face mask while I'm working out? The short answer is yes.
Gyms and fitness centers allowed to reopen on Monday as phase 2 is scheduled to begin.
You might be saying, I'm dying to go back to the gym. What is it going to look like? The answer is you can go back to the gym, but like everything else in our lives, it's going to be different.
The new guidelines call for a reservation system and participants of group activities or classes to stay in consistent groups of up to 15 people. Locker rooms will remain closed and common equipment sanitized between each use. Like with restaurants, staff and customers will have to leave their names and contact information in case the Department of Health needs to call them. Close contact activities like boxing or wrestling will still be prohibited, and outdoor exercise is strongly encouraged. And what about cloth face coverings? Those must be worn while exercising, and people must maintain 6 feet of distance even with a mask on. If someone is not wearing a mask while exercising, they must stay at least 14 feet away from others.
We know that the virus, based on studies, particularly one that the Centers for Disease Control and Prevention produced several weeks ago, the virus can travel up to 13 feet distance, which is even more so when you're engaging in vigorous activity.
Governor Raimondo says she knows the rules are not perfect, but she is hopeful that gyms and other fitness centers will open under the new guidelines.
A lot of people are asking me, do you think it's safe? Would you do it? The answer is yes, I would.
And the governor also said today that youth sports will happen in Rhode Island this summer. She said she is going to give more specifics on that topic tomorrow. She'll also talk about guidelines for indoor dining at restaurants and what you need to know before going to the salon or barber. Live at the State House, I'm Kim Kalunian, Eyewitness News.
First at 5:30, Governor Gina Raimondo has announced new assistance from the Red Cross for families who've lost loved ones to COVID-19.
Now the service is free and confidential, and the governor is urging families to get in touch with the Red Cross if they need help. Shortly before the governor's daily briefing this afternoon, members of the House Minority Caucus gathered at the State House lawn. Eyewitness News reporter Kim Kalunian tells us why. Kim?
Well, today, Republican state representatives calling on Democratic members of the House Oversight Committee to reconvene with or without permission of the House Oversight Chair or the House Speaker. The reason? To look into the crisis at the state's nursing homes where the vast majority of COVID-19 deaths have occurred.
I am ashamed of House Oversight as the longest serving member on that committee. I am ashamed that we have done nothing. And I hope my colleagues feel that shame as well, because it belongs to us and only us.
Governor Gina Raimondo was asked about their calls today, saying it's up to the committee if they would like to meet. She also says the state has tried to be as transparent as possible as they work to ensure staff and residents of nursing homes are safe.
If anyone has a specific idea, if that committee wanted to be a productive partner in saving lives, then give us some concrete ideas, because we are wide open to that. Second guessing what we've done, I'm not sure how that's very helpful at the moment.
In a statement, House Speaker Nicholas Mattiello saying leadership teams from the House and Senate decided weeks ago to take a uniform approach to oversight in the form of a task force. He says they will not duplicate their efforts, saying, quote, the House and Senate leadership teams have been in constant communication with our nursing homes. It is not appropriate to play politics, particularly at a time when these nursing homes are working so diligently to save the lives of our most vulnerable populations. State officials say today that 16 of the fatalities that they announced were connected to nursing homes. Roughly 75% of all of the state's COVID-19 related deaths have been connected to congregate care facilities. At the State House, I'm Kim Kalunian, Eyewitness News.